each year, billions of dollars in aid for people in need goes unclaimed. Learning how to navigate the system and plow through paperwork, though, can really be the difference maker. Joining me now is Dr. Alistair Martin, an ER physician at Mass General and founder and managing director of Link Health. How are you today? I understand you came to us right from your overnight shift at the ER. I'm glad you're here today.
That's right, Karen. Great to be here.
All right. So, Dr. Martin, explain to us what Link Health does and how it breaks down barriers to accessing programs.
That's right, Karen. So, in my job in the emergency department, what most people think of is, they think about Grey's Anatomy. They think about George Clooney in ER, But the reality is what they don't see are the faces of poverty. That young mom of two who has 3 jobs that has to decide where she's going to take her kid when the pediatrician's office is closed. Or the homeless man I saw last night whose birthday it was, who had nowhere else to go. These folks are living paycheck to paycheck, and they're making decisions every single night around, do they take care of their food, their rent, or do they take care of their medications and their co-pays? And so what we do at Link Health is we help people enroll in things called cash assistance benefit programs. SNAP, WIC, rental assistance, utility assistance, all of these programs that they qualify for but maybe have not submitted the applications for. We meet them,
don't know that the programs exist.
That's right. We meet them right there in the waiting room, and we enroll them in these different programs. So by the time they leave with money in their pocket.
What role do students play in this Link program?
Yeah, it's one of the things I'm most proud of, Karen, this idea that we work with pre-medical, pre-nursing, PA students, and we train them on how to do these enrollments, how to have these conversations, and how to submit these applications on behalf of patients. So not only are we helping patients achieve this new financial stability, we're also helping these students gain a new skill set that will help them in their healthcare careers.
The Congressional Budget Office estimates that 4.8 million people will lose coverage when the new Medicaid work requirements take effect, but it's not because they don't have jobs. It's about the paperwork.
You got it. It's the opacity of the system. This bureaucratic nightmare that we're going to have patients run into is going to mean that so many of our patients are going to get kicked off of things like Medicaid or SNAP. And that's where we come in as Link Health. We help people cut through that paperwork, get them those requirements, and make sure that they have all the documentation they need to get these benefits that they qualify for.
Now, do you keep up with the patients or you just get them started?
That's right. We absolutely do. Yeah. So we follow up with folks, and it's not just about submitting the application. It's about making sure that they actually receive the money, and if they don't, trying to work with the state and the city to figure out what went wrong.
So what motivated you to start Link Health? I mean, was there a patient or an experience that inspired you?
Look, every night I go into the emergency room, what I see are the faces of failed policy. Folks who are struggling to just make it in this city. And at the end of the day, there's only so much that I can do in the 4 walls of my ER. And I worked in government for a stint down in DC, where I came to find out that there's about $142 billion in these very programs that goes unused every single year. And I started to think, well, gee, what would a program look like if we could connect the dots? And that program is Link Health.
Now, you talked about some of your experiences with patients, and of course, you're humanizing the process and and what it takes to help bridge gaps. But what about AI? What impact is AI having, and internet access in general? How does technology play a role in access to this information?
It's a great question. Look, at the end of the day, these applications are asking the same questions, Karen. They're asking your name, your date of birth, your age, your address. So what we do is we use artificial intelligence to help us with some of the sort of bureaucratic aspects of these applications, reducing the redundancy, making it easier for our navigators to get these applications submitted. And we've been able to, with the use of technology like artificial intelligence and our navigators, submit over 4,500 different benefit applications. And that's resulted in $5 million dispersed to patients in need.
$5 million, that's a lot.
Yeah.
So it's clear how Link Health helps individual patients, but is there also a societal benefit?
Such a good question. Such a good question. At the end of the day, look, if a patient has nowhere else to go, right? If they're struggling with a cough that might be pneumonia or shortness of breath that might be heart failure, if they've got nowhere else to go than the emergency department, guess what happens? The emergency room wait becomes longer and longer and longer and longer. When we give patients options, things like primary care, things like telehealth.
And we pay for emergency room care.
You got it.
Through our health system.
You got
through our
it.
health plan, right?
You got it.
Right.
And so at the end of the day, you know, what we're doing here is by providing financial stability, we're actually lessening the strain, the burden on places like emergency rooms, so that when you have an emergency, we can actually take care of you and not have to have you wait 8 hours, 9 hours, 10 hours.
Wow. Dr. Alistair Martin, you're doing great work over there.
Thank you so much, Karen.
All right. Thank you for joining us.